Altus Hospice is an organization that goes into a local community and builds a local-based hospice. We take great pride in going into that community, identifying physicians who want to actively become a part of the hospice care. Our goal is to provide physicians in that local community the empowerment to continue to follow that patient once they reach that time in their life.
As a physician, I felt that Altus, right from the beginning, had been different because they want us to be involved in building up the way we take care of these patients in our area.
We seek out physicians in that local community to actively play a role, both through partnership and through just simply a community-based hospice. The reason we empower our physicians to maintain that care once they're on hospice, they know that patient better than anyone at that time period. Instead of passing that on, it's important that that physician maintain that relationship.
Being an investor with Altus means that whether you're an investor or not, you're going to take care of your patients, you're going to take care of them at this critical point in their life. With Altus, what you get also is that at the end of the quarter or the year, you do get something back for that investment money you put in at the beginning, and you get rewarded for that good work taking care of those patients the way you wanted to take care of them.
We recognize that not all patients have the ability to cover all of their health care. We've got a foundation that's put in place for us to be able to help with those additional needs that the family and or the patient might be experiencing.
When I need that specific care that I gave to the patient that is insured, and the patient does not or cannot afford it, he will still have the exact same quality and excellence of care.
Altus Hospice comes in with a total patient care service package, from social worker to clinical skills to home health aides, volunteer coordination, bereavement care.
At Altus Hospice, our nurses and practitioners tend to visit our patients and their families a little bit more than the standard in the community.
Our team approach allows us to come in with that family and with that patient and surround them with care.
We are there to make sure that, number one, the patient's pain and symptoms are managed. We're also there to provide emotional comfort and support.
Right when we make the decision that this patient will need hospice, it's always involved the family. The patient always looking for somebody for comfort. This is immediately their family members. Altus Hospice acknowledge that right at the beginning, involving the right people to talk to the family first, the physician, and the patient. They do connect with patients and their families at the personal level. That's exactly what you need when you talk about palliative care and end-of-life care.
We are there for at least 1 year after the patient passes away to make sure that the family or the significant others are moving through the grief process well.
That continuum of care between that primary care, the medical director, and the nurses, combined with the services we provide, gave them the opportunity to experience dignity, gave them the opportunity to experience the continuum of care we feel like is necessary during that time period.
We have one opportunity to get this right. We know many times our patients do not have tomorrow, so we want to give 110% at each and every opportunity that we have in order to make sure that this is a pleasurable experience for the patient and the family during this very trying time.
I have no hesitation to recommend Altus Hospice to my fellow physicians working in the community because I felt that I made the right decision right from the beginning by taking care of all my patients under Altus Hospice. Altus Hospice has always been there for me so that I could be there for my patients the way they need me to take extra care of them, especially at this critical point of their life.
Our entire team has a passion for hospice. I think that's one of the things we're most proud of. If you don't have a passion for hospice, you can't provide the care that we expect to provide to our patients.